Hello, and thank you very much for the invitation. It's really a pleasure to be here. I've learned so much over the last 2 days, although I've been very sorry to miss the beginning of the conference. Let me start by telling you a little bit. Too loud?
No, you're good. Just a little closer.
Closer? Oh, okay. My own work focuses on long-term care. This is primarily working with support services for older adults with support needs and for adults with disabilities. But a lot of the concepts that are essential in our own area of work, I have seen represented here so vividly. And there are a few concepts that are more prominent in long-term care that I think could be very useful for this audience. So what I'm going to try to do today is talk about a life course approach. This is essential for the health agenda, for the healthy aging agenda, for the equity and inclusion agendas. And I'm also going to try to talk about the potential and the necessity for early intervention within this approach. And really, a word of thank you to conceptualize everything, because the work you do, your successes in early child care, make our job much, much easier. Because today's healthy, happy children are tomorrow's healthy, happy adults, and quicker than you think, they're going to be the next generation of older adults, and the investments that we do in their health and well-being now are going to determine the needs that we're going to have to respond to in the future. But really, I want to talk about care, because this word has been used a lot, and I'm not sure it has been defined properly. In a societal perspective, care really refers to all the activities undertaken by others to ensure that those who cannot fulfill these activities independently can maintain a standard of living and of functioning that allows them to reach their full potential. This was said over and over. That fulfills their human rights. So I'd really like to put a bit more focus on a rights-based approach in everything we do, and that helps them to maintain human dignity. This is our focus. It's about dignity, it's about quality of life, it's about rights fulfillment. Care is overwhelmingly provided by women. And I have to say and emphasize, there is no possible progress in the gender equity agenda if we do not address the issues in our systems of care, formal and informal, and the very, very imbalanced way that care responsibilities are divided. Just a few days ago, if I'm allowed a parenthesis, the Global Gender Gap Report for 2023 came out. We are back to 2020 levels, so we have almost overcome the effect of the pandemic. And let me maybe do a quick audience poll of all the ladies in the room and ask them if they're happy and okay with the fact that we'll probably have to wait about 131 years at current progress rates before we can talk about gender equity in the world. So everything we talk about today and your work is essential to pushing this agenda forward. Now let me take a step back and talk a little bit about care from a system perspective. From a care system perspective, the scope of long-term care service is a bit narrower, but it still includes, very importantly, personal, social, and health care services. Yeah, these are essential. All of these types of services have to come together. They are essential to maintain functioning. Mariana talked about that, I won't go into detail, and maintain intrinsic capacity. Why is care important over the life course? I won't go into details because time is tight, but I will just say that at every stage during the life course, care and support are essential to maintain human dignity, quality of life, fulfill human rights. Now, there are a few specific aspects. So when we intervene in childhood, we really focus on prevention. We focus on facilitating development. When we intervene in adulthood, we try to focus on participation in the labor market, in the social environment. And in older age, we focus a bit more on maintenance of quality of life, of dignity, of inclusion. But by and large, we go at it throughout the life course with very similar goals and very similar approaches. Now, I was asked to focus on early intervention, and early intervention really means in utero and in the first 3 years of life. From WHO's perspective, the effect on health from early intervention cannot be overestimated. Prevention always is our best bet, and we actually have growing evidence, if more was needed, that all NCDs, all chronic diseases with large burden of disabilities, have risk factors in early childhood. That is where the problem begins. That is where the health issues have to start being addressed. Now, I wanted to highlight here the Nurturing Care UNICEF WHO report. You probably are familiar with it. It's a fantastic toolkit. I really encourage you, if you're not familiar with it, to look it up and read it. It's available in many languages, and it looks at strategic actions across 5 priority areas. I chose only 2 to highlight here because of the focus of this conference, but really the aspects that I want to focus on today are around the second one, how we invest in families and communities. I've heard a lot in the last 2 days about how we develop services, how we develop benefits, absolutely essential. I've heard quite a bit, so I won't go into detail in the 3 levels of support, the difference between universal, targeted, and indicated interventions, all essentials. So I'll try to focus a little bit on investing in families and communities. And why is this important? Because really where we are in care systems is that the vast majority of care is provided informally by families and communities, whether we talk about children or about older adults. So our main support system remains a family, community-based, informal support system. This will continue to be the case. It is not our goal. We should not try to, and we cannot possibly replace care provided by families with services. Now, talking about older people alone, this is a statistic I'm familiar with. The care that is contributed informally by families, by women primarily, or by volunteers, would account, if it was costed, for about 3.8% of GDP. This is way more than what we invest in services. This cannot be replaced and compensated. So well, I'll go back for a second. I think it was on the slide. The point really was the only strategy we have for sustainability of care systems actually is investment in informal resources. I'll skip over this. Quite a bit was mentioned about the need to increase availability and accessibility of services. I won't belabor the point, but there were a few aspects that I thought would be useful to emphasize. Fragmentation. A lot of people end up in institutions not because the services don't exist, but because it's very difficult, if not impossible, to access these different services in a timely and continuous manner. The difference between the community and the institution is often that in the institution we can put services around people, whereas in the community, the people who need the services themselves have to manage the system independently, and that's very difficult. Another aspect I haven't heard mentioned so much is the diversity of type of services. We have 17 or 1,700 different types of mobile phones in the world, but we have 1, 2, 3 types of services available to people with disabilities. And again, the aspect of human resources was mentioned, so I won't go through that. The investment case was also made, so I'll only highlight the main points here, and I'm gonna just probably go for the punchline. The cost of service provision pales in comparison with the cost of inaction. We talk about costs and about budgets, but we don't think as much about the societal impact of not investing in resources. The productivity losses alone, not to mention all the indirect costs on the economy, are many, many-fold higher than what we invest in services. So if we think about care in the context of social cohesion, of economic development, of economic growth and human flourishing, there's absolutely no way to make an economic cost for not investing. How do we support informal caregivers? We've done quite a bit of work, and we will continue to work at WHO Europe on developing resources to support informal caregiving. Why? It's important to protect their health. We are often putting caregivers, again, women, mostly women, in situations that affect their mental health, affect their physical health, and accelerate their own progress into becoming reliant on care and health services themselves, which is, I'm doing everything wrong again? Okay, sorry. And another essential aspect is reconciliation. So we've heard about care and cash benefits. How do we help caregivers reconcile their care responsibilities, which often are frequent and intensive, with their own priorities and their own desires in life and their own financial independence? A woman who must give up work to care for children or to care for older adults is a woman who's at risk of poverty in old age and who's very likely to be highly reliant on pension systems, on welfare system, on social support system. So by failing to invest, we are creating our future care and social protection users. Finally, caregiving can be isolated. I don't have time to go into the stigma, but I really hope that that this is, taken up a bit more and discussed a bit more openly, because we talk about the stigma of being a person with a disability or needing support, but we don't talk as much about the difficulties that caregivers experience. I won't go through this. There are many, many ways that we can support informal caregivers. Very importantly, informal caregiving resources generally. We need to understand who they are, and we need to start asking them more seriously what type of support they need. We need to provide respite. We need to give them alternatives. We need to invest, counseling, support self-care and management, and provide financial support, as was said over and over. So I'll end on this. What are our strongest levers for policy interventions for sustainable, long-term, life course investment? First and foremost, investment in families and communities, working in partnership with them, not assuming we know best what they want and what they need. We need to increase the prominence of disability inclusiveness in the health agenda for children. This is already the case to a large extent for older people. When we talk about healthy aging, we do talk about care and disability quite a bit. It's not always the case for the health of young adults and adolescents and children. We need to invest for sustainability, so I would really like to hear more discussion about investment and hear the terminology of investment rather than the terminology of costs and budgets, because these are investments and they are absolutely necessary for a cost-effective approach to service development in the context of demographic change and of changing morbidity patterns. And finally, I think it is essential that we prioritize coordination and share the accountability across sectors. And in this vein, I really, again, want to thank the organizers for inviting us here today and, for bringing WHO close to the discussion. Thank you very much.
Thank you very much, Stefania.